Introduction. Pterygium is a common eye disease where conjunctival tissue grows onto the cornea. It causes visual disturbance and discomfort. This video will cover its causes, effects, treatment options, and long-term outcomes. Pterygium originates from abnormal limbal epithelial cell growth and migration onto the cornea. Signaling pathways like TGF-beta, growth factors like VEGF, and enzymes like MMPs contribute to pterygium development, causing tissue formation, angiogenesis, and remodeling. Excessive UV exposure, specifically UVB, increases the risk of pterygium. UV radiation damages DNA and eye surface cells, requiring repair. In individuals with compromised DNA repair, pterygium may develop due to accumulated damage. High levels of DNA damage markers, like P53 and P21, are observed in pterygium tissue. Additionally, UV radiation triggers the release of pro-inflammatory cytokines and chemokines, which exacerbate the inflammatory and proliferative processes in pterygium. Inflammation plays a crucial role in the development and progression of pterygium. Various pro-inflammatory cytokines, such as interleukin-1, IL-1, tumor necrosis factor alpha, TNF-alpha, and interleukin-6, IL-6, have been found to be upregulated in pterygium tissue. These cytokines promote the migration and proliferation of epithelial and fibroblastic cells, contributing to the growth of pterygium. In addition to cytokines, chemokines, such as CC motif chemokin ligand 2, CCL2, and CXC motif chemokin ligand 8, CXCL8, play a role in recruiting inflammatory cells to the pterygium tissue. The amplification of the inflammatory cascade through cytokines and chemokines creates a microenvironment that further fuels pterygium growth. Oxidative stress, caused by an imbalance between reactive oxygen species and antioxidants, plays a role in pterygium development. Increased oxidative stress markers and reduced antioxidant levels in pterygium tissue suggest impaired antioxidant defense. Antioxidants may have a therapeutic role in pterygium management. Genetic factors play a major role in the development of pterygium. Variations in genes involved in DNA repair, antioxidants, and inflammation have been linked to an increased risk. Identifying these genetic markers can help tailor treatment strategies for individuals with pterygium. Advanced imaging techniques, such as optical coherence tomography, anterior segment photography, high-frequency ultrasound, and in vivo confocal microscopy, allow for detailed visualization and assessment of pterygium morphology. These techniques provide valuable information for diagnosis, treatment planning, and monitoring of the disease. Angiogenesis, the formation of new blood vessels, is a key process in pterygium growth and progression. Anti-angiogenic therapies have shown promise in inhibiting pterygium angiogenesis and reducing its recurrence rates after surgical excision. Drugs targeting specific angiogenic factors, such as VEGF inhibitors, bevacizumab, ranibizumab, and platelet-derived growth factor, PDGF, inhibitors, triple therapy with bevacizumab, mitomycin C, and 5-fluorouracil, have been investigated for their efficacy in pterygium management. These targeted therapies aim to disrupt the angiogenic cascade and inhibit the aberrant blood vessel formation in pterygium tissue. Further research is needed to optimize dosing regimens and evaluate long-term safety and efficacy outcomes. Several growth factors and angiogenic markers have been studied to gain insights into the molecular mechanisms underlying pterygium development and progression. Immunohistochemical analysis of pterygium tissue has revealed upregulation of factors such as VEGF, fibroblast growth factor, FGF, and platelet-derived growth factor, PDGF. These factors promote cell proliferation, migration, and angiogenesis, contributing to pterygium growth. Furthermore, the expression of angiogenic markers, such as CD31 and CD105, has been observed in pterygium vasculature. Understanding the expression patterns of these growth factors and angiogenic markers can aid in the development of targeted therapeutic interventions for pterygium. After surgery for pterygium, there is a risk of the condition coming back. Research suggests that larger pterygium size increases this risk due to incomplete removal, limbal stem cell deficiency, and increased angiogenic potential. Surgeons can use this information to improve outcomes. Pterygium affects tear film stability and ocular surface health. It alters tear film dynamics, leading to instability and reduced tear breakup time, causing discomfort, blurred vision, and irregularities. Correct management is crucial for visual rehabilitation and patient satisfaction. Pterygium surgery aims to remove abnormal tissue and restore vision. Different techniques, such as bare sclera excision and grafting, are used based on factors like pterygium size and location. Surgical approach can affect refractive outcomes, so it's crucial for surgeons to choose the right technique for optimal results. Long-term follow-up of pterygium patients is crucial to evaluate the efficacy of treatment interventions and identify potential complications or recurrence. Recurrence rates remain a concern despite surgical excision and other treatment modalities. Long-term studies have reported recurrence rates ranging from 10% to 50% after surgical intervention. Other potential complications include corneal Dellin formation, graft recession or dehiscence, graft-related complications, and dry eye syndrome. Additional long-term studies are needed to assess the impact of novel treatment approaches and to identify predictors of recurrence and postoperative complications. Regular postoperative follow-up visits are essential to ensure early detection and appropriate management of any complications or recurrence. Pterygium is a complex ocular surface disease with multiple factors involved. Scientific research has provided valuable knowledge on its causes, effects, and treatment methods. Further research and collaboration are necessary for better management and innovative therapies, enhancing patient outcomes.